Hello, it's Dr. Rhonda Johnson. Today's Wednesday, December 8th, 2021, and my message today is what you can expect if you're hospitalized with severe COVID-19. And my message today is modified from an article written by a respiratory therapist who is on the front lines in a California newspaper in August 2021. She discussed what the 7 stages of severe COVID-19 look like for patients who are hospitalized. So let's start with stage 1. It's so hard for you to breathe that you come to the emergency room. Your oxygen saturation says you need help. You get admitted, you get started on oxygen, other medications. You spend several days in the hospital, but you get weaned off the oxygen and you go home. If you're fully vaccinated, most likely your hospitalization story ends like this. But if not, you go on to stage 2, where breathing becomes much harder. Many patients describe this feeling as like they are drowning. Little things like going to the bathroom or sitting up in bed become impossible. So you get transferred to the ICU. Stage 3, you can't get air into your lungs. You get put on a big, bulky face mask that must be Velcroed tightly around your face so the machine can push air pressure into your lungs to keep them open. Stage 4, your oxygen in your blood gets critically low. They prepare to intubate you. If there's time, you will get a phone call to make with your loved ones. And sadly, that may be the last time they'll hear your voice. You get paralyzed, connected to a ventilator that breathes for you. You're fed through a feeding tube. You have a Foley catheter and a rectal tube inserted. You get flipped over on your stomach to allow for better breathing. And yes, you go on lots of experimental medications to help you live. Stage 5, you haven't improved on several days on the ventilator. Then the machine called ECMO, which bypasses your lungs and oxygenates your blood, gets considered if the hospital has a machine. This allows your lungs sometimes to heal, but most community hospitals don't have an ECMO machine. And if you're stable enough and there's a bed, you might get transferred to a tertiary hospital. Otherwise, you have to stay in the local hospital and they treat you the best they can. Stage 6, your kidneys fail. You require dialysis. Other complications such as pneumonia or a blood infection or a blood clot may happen. Your blood pressure may drop critically and they have to give you vasopressors to bring it up. But no matter what, your heart may stop and fail. They give you several rounds of CPR, but soon your family will have to make a difficult decision. Stage 7. After several meetings with the hospital staff and different teams, your family decides to withdraw care. They turn off the breathing machine. You get a final FaceTime call with your loved ones. You may not be aware of that, but lots of crying and loving goodbyes are said. Oftentimes, the hospital staff taking care of you are holding your hand, and they are crying too. And then you take your last natural breath. Now, not everybody's story goes like that. Some people survive stage 7, but these survivors are the miracles. And folks, this happens hundreds of times, thousands of times every day in hospitals across the United States. And the majority of the people are unvaccinated. But it doesn't have to be this way. You can prevent this scenario from happening to you. Get the COVID vaccine. Get your COVID vaccine boosters. Get your children vaccinated. Please, do it now. Don't wait another day. Just text your zip code to 438-829 and you will get 2 locations near you. I know this is a hard video to watch because many people don't want to hear the reality of what happens in the final stages of COVID-19. It's not pretty, and it doesn't have to be. And healthcare professionals have been sounding this alarm for almost 2 years. Take care of yourself, folks. Get vaccinated. Encourage your friends to get vaccinated and share this message. As always, my views are my own. It's Dr. Rhonda Johnson, and have a blessed day.